How to reduce fatigue during pregnancy is just simple. Take a little nap when necessary. When your body needs it, just take naps. And try to take some energy boosting snacks. Today we are in week 11. I don't know how I'm going to describe that. All along I've been using my fingers to do it, but I'm stuck. I have just 10 fingers. So we're in week 11. Yeah, week 11. Good. So welcome. By week 11, your baby has developed distinct human characteristics and you may want to start exercising your body. Exercise is not because you want to get some muscles, but it is essential to tone your body so that you maintain a pre-pregnancy figure, as well as make it easier for you when you are in labor, and also help you with postnatal recovery. But make it simple and moderate. This is not the time to start getting into some fitness routine. That's not the reason for this. So you have to make it as simple as possible, especially if you're the type that never exercised even before pregnancy. So if you have a little time to do a little shake off, do take advantage of it. Exercise safety. It's better to ask your doctor's advice as far as any fitness program is concerned during pregnancy. The reason is because there are people who are special in the sense that some may have experienced miscarriage in time past, and the doctor just doesn't want to get into such gamble. So the doctor might ask you to stay away from exercise, and that's just one of it. You don't know the kind of examination that's been done on you that will require you to either do or not do any kind of exercise. Always follow safety rules while exercising. And before you even try to exercise, you have to actually check out some safety rules before making up your mind. Avoid jarring and jumping movements, as your tendons and ligaments are more prone to injury during pregnancy. Don't get dehydrated. Take water before, during, and after your exercise. You don't want to get dehydrated. You need all the hydration you can get. Wear a good sports bra before making up your mind. Make sure you have them ready. Wear a good sports bra to give you the support that you require. Your breast will not even show you any mercy. Stop immediately you feel any pain, any discomfort, breathlessness, or dizziness. Just stop. You don't want to raise your body temperature. Brisk walking, jumping, cycling, some kind of step aerobics can raise your body temperature. So you have to be very careful about the kind of exercise that you do. Meet an instructor that knows what exercise a pregnant woman should be doing, not just some random gym instructor. Be sure about what you're doing. If you're going to be getting the exercise in the hospital or a hospital environment, or by somebody who is a specialist in the area of helping pregnant women exercise the required areas of the body, please just go for it. Don't just pick anybody and don't just pick any kind of exercise. Do your research. How to reduce fatigue during pregnancy is just simple. Take a little nap when necessary. When your body needs it, just take naps. And try to take some energy boosting snacks. Like you can take nuts, you can take crackers, you can take any kind of fruits have sugar in them, natural sugar, that can help to boost your energy. So you have to do things that can help you during pregnancy. Let's face it, your body is overworking and it has an individual growing inside it. You cannot be the same. Everything about you is shared into two between you and your baby. So however it is that you can gather a lot of energy, please do take advantage of it. And that also includes dry fruits. The drier they are, the sweeter they are. So you can explore that too and make yourself and give yourself a little boost in energy. Tips for week 11. I want to say something. Washing your hands. When you say wash your hand, you'll be like, which one's wash your hand? Why wouldn't I wash my hand? Yes, you have to pay so much attention to that. The reason is because you can't afford to have some microbes worrying you at this point of your life, because as it is, your immunity is slashed so that your body can accommodate the growing baby. If your immunity is strong, it's going to kill your baby. So automatically conception slashes your immunity. So washing your hand will keep you away from all sorts of germs. You have to do that with dedication. Everything you touch, before you put your hand into your mouth, your eye, or any area, make sure your hands are always clean. You have to keep gingivitis away from you, inflamed gums. And one of the ways you can do that is to eliminate anything that results into plaques. So floss your teeth, wash your teeth in the day and in the night so that you don't have you don't have plaques built up on your teeth. So snack on nuts if you're not allergic to nuts, and foods that can build up your calcium content so as to protect your teeth. So what happens to you in week 11? Morning sickness reduces. Well, that is no longer a problem because your baby is beginning to adjust to the hormones in your blood as your baby grows. So he's beginning to get familiar with the whole environment. So there's the reaction. It's more like a reaction. You take a drug and you take a drug and you get reactions. But this baby is let me just use the word drug. Is a drug that you have to accommodate, So your baby, your ability to accommodate this new growing individual inside of you is one of the things you experience during morning sickness. So now that your baby has become accustomed to the whole hormone in the blood, you're getting better. Your heart becomes stronger and more efficient at working with its increased workload because you have now more blood in your body. You have more blood pumping in your body, and you feel breathless as time goes on because your circulatory system is making more demands on your body because of your baby. So what's happening to your baby? The external genital of your baby is beginning to develop. The baby's organs would have been formed inside the torso, and what happens now is it continues to develop and grow. It's already formed, it only develops and grows as the time goes on. Your baby starts practicing the sucking reflex in preparation for breastfeeding. Your baby may swallow amniotic fluid and excrete it as urine. As a baby's neck muscles and bone develop, the head of the baby will start shifting off the chest. So wonderful people, that is all for week 11. I hope you enjoyed it. If you did, please give us a thumbs up, and if you're not yet a subscriber, why not hit the subscribe button, and we'll see you in week 12. Bye bye for now.